Good evening, everyone. Is that my screen is visible?
Yes, ma'am.
Yes.
Yeah. Good evening, and I'm Surya. I'm working as a senior manager quality for MGM Healthcare, and this is a wonderful opportunity that I have got from Tena sir. Thank you so much, sir. So I was able to prepare myself for this wonderful session. And today, what we are going to discuss is about the essential charts for the healthcare quality and the patient safety visualization is what today we are going to discuss. Actually, we are collecting a lot of various data from the every area of our hospital. So these are all the different types of charts. For distribution, we can use pie chart, bar chart, histogram, and the Pareto chart. When we wanted to show the variance or variance on our data, we can use the histogram and the control chart to know the trend in our process. What is the trend, whether we are improving or not, that we can use line chart in order to know the pattern, the shift in the process, whether any pattern in the process. We can use the run chart, and for showing the compliance about whatever the standards we are following for the gap analysis, we can use the radar chart. And to show the timeline of our projects or process, we can use the Gantt chart. So these are all the different types of charts we are going to discuss on today's session. And we will be able to know each and every chart in a detailed manner. So we need a particular amount of data for displaying into each and every chart. So what are all those datas we require, and in what when we can use all this chart in our day-to-day quality life. This is the small description about it. So in order to show the distribution, we can use bar chart, pie chart, histogram, and Pareto. To use the bar chart, mainly we use bar chart to show the comparison. So we will be having the discrete data. So in order to compare the various categorical or discrete variables, we will be able to know what is the comparison between those variables. So during those time, we will be using the bar chart. For pie chart, the any proportions, when we have our data, the categorical data in the percentage. So in order to we will be able to show in the proportions. So through pie chart, I will be able to know in the total segment what is the smaller segment contributing, what is the bigger segment contributing into my process. For histogram, we will be able to understand the distribution. So for histogram, we will be needing the continuous data. By the histogram, I will be able to know what is the distribution of the occurrence and what is the type of distribution also I will be able to know. And by using the Pareto chart, the Pareto chart is the wonderful one which shows the prioritization. So it shows the what are all the errors I need to concentrate. So we need the qualitative data, and this is one among the good tool for root cause analysis, where we will be able to prioritize the first set of errors, where the vital errors, where we have to concentrate at first by applying the 80-20 rule. For coming to the variance, there are two types of charts we will be using for displaying the variance. That is the histogram and the control chart. And the histogram, we just discussed about it. It will show the variance of the aggregated data. So we will be needing the continuous data for that. So we will be able to visualize what is the variance for the aggregated data. The control chart, I will be able to know what is the common cause of the problem and what is the special cause of the problem. And it also shows the variance. And I will be needing the time series data. So it will be determining, I will be able to know whether my process is stable and whether my process is within the expected range within the expected range, when my outcomes are within the expected range, I will be able to know. When I am analyzing my trend, I will be using the line chart, and the line chart will be I will be needing the time series data for that. And to track the changes in my process, whether it is improving, whether any deviations is happening, whether it is deteriorating, I will be able to know through the line chart. For knowing the pattern, if there is a shift, any pattern is there, we can use the run chart. So I will be able to kind of track any improvement over the period of time. So any trend is there, whether I have improved, whether any deviation is there, and I will also able to compare what happened before and after applying the solution into my process. So in order to know the compliance, for the gap analysis, we use radar chart. It will very much display the outliers wherever I need to concentrate, where the compliance rate is higher and the lower. And the scatter diagram is mainly for relationship. So when there is a two variables, what is the relationship between those two variables, how it is affecting one another, performance of the one another, I will be able to know by using the scatter diagram. The quantitative data is required for displaying the scatter diagram. The Gantt chart is for the process where the categorical data will be used, and I will be able to know from where I am starting, where it ends, and what is the time period it's taking. I will be able to know using the Gantt chart. So these are all the different types of charts we can use for the different types of data we are collecting onto our day-to-day quality life. And these are all the time period. These are all the time when we are using those charts also. So now we will go one by one into detailly about into the bar chart. So bar chart is mainly for comparison. So here, these are all the data which we have collected from my own hospital, my previous hospital. These are all the real-time data. So I have tried to apply the charts into the real-time data, and I have displayed over here. So this organization is having around 10 OTs, and they wanted to know the performance of each and every OT in a particular month. So here, the number of surgeries happened in particular OT is collected for the particular period of month, and it is displayed into the bar chart. The hospital has a different 10 different OTs, and which assigned to the various specialities. So we will be able to know which OT is performing higher. So in this chart, we are able to know that OT3 is performing more number of surgeries has happened in the OT number 3, and we will be able to know what are all the specialities are using, what are the type of surgeries they are is posted over there. So in that particular period of for 1 month, we will be able to know. So the other examples are we will be able to know number of outpatients seen by the consultants for a particular department. We will be able to know number of patients visited the OPD from the various campaigns we are having. A particular organization is running, and number of falls from every area in a hospital. These are all the things which we can display in the bar chart. The pie chart is we are going to present the percentage, the proportion. So this organization has collected the surgical site infection rate, and they are doing the surveillance call after 30 days and 90 days. They are doing the surveillance call. So particular period of time for the April, June, and July month, they wanted to know what is the process. Whether what is the process which happened for the surveillance call. So this pie chart, the first pie chart is telling the 42 percentage of calls, 42 percentage of patients falling under the 30-day surveillance, and 58 percentage of patients are falling under the 90-day surveillance. The second pie chart is showing so what is actually by the calls, what they have actually known. So it is saying the 4% of 4% of patients they do not they couldn't even track the UHID, so they couldn't track. So 12% of people they did not even respond to the call. 15% of people have reviewed, but there is no OT notes. So what happened to the surveillance that we are not able to track, and 5% of people was having some infection and it has been treated, and 64 patient has been reviewed and they are found to be healthy. So around 64 plus 5, around 69 percentage, the patients are very clear, where the other areas that mainly that 15 percentage of patients we not able to track because there is no OP notes at all. So that is what this pie chart is explaining. So the same way, we can display the proportions of CPR events according to the gender, and also we can display the proportion of the COVID vaccine among the employees in a hospital also we can display through the pie chart. The histogram. Next is the histogram. The histogram is to show the distribution and the variance. So, in an organization, the number of people started to visit the patients. So, the service excellence team visit, physiotherapist visit, and the other people, the housekeeping visits. So, the patient compliance has increased because that they are getting disturbed. So the small data collection is being happened. So what is the time in a day the patient do not wanted to get disturbed? So the data is being collected from the which started from 1 a.m. to the next day 12 midnight, and it is the data is being collected. So this is the bell curve histogram, and it shows that during the period of 1 o'clock to 2 o'clock, the patient do not wanted to get disturbed. So the same wise, so that is what this histogram is explaining to us. The same way, we can derive the pharmacy dispensing time, the length of stay of the patient in an organization. These are all the data also we can display into the histogram, and we will be able to know about the process. This is the Pareto chart. The Pareto chart is mainly used for the prioritization. So here, what we have taken here is the medication errors. So there are different types of medication errors. That is dose missed, wrong time, wrong drug, overdose. These are all the various medication errors is being listed. And what is the number of medication error? What is the number of incidents happen for according to the each and every error? This the cumulative percentage of the each and every error is also taken. So this chart is explaining the number of incidents of in the each type of medication error is displayed in the bar chart. So the bar chart is as arranged in the descending order, and the cumulative percentage of the each error is displayed in the opposite y-axis. So those red dots are the cumulative percentage of the each and every error. So 80 and 20, 80 by 20 rule is applied. And now we are able to see that the red points is getting divided. The red points is getting divided. The all the red points, that is a cumulative point. So now here, these are all the red points or the cumulative points. The red points which is falling below the 80 percentage of that 80 percentage line, those are all the vital few causes where I need to concentrate more. So that is the 80 percentage of the entire incidence which is contributing to the medication errors. The points whichever is falling above the 80 percentage line is the very minimal percent. The 20 percentage only it is contributing to my entire medication errors. So that is how this Pareto chart is explaining where I will be able to concentrate more and what is the area we need to prioritize. So these are all the things we will be able to know the through the Pareto chart. So this is the one among the very good tool for doing the root cause analysis for the various processes we do in our quality life. So we will be able to know the what are all the causes for delay in discharges in the emergency department or through the insurance patients, etc. Area of the faults which is occurring more. So these are all the other data where we will be able to know from the Pareto chart. So usually for the cause and effect, we used to use only the fishbone diagrams. So these many days I was only using only the fishbone diagrams. So the problem with the fishbone diagram is the vague idea of entire problems will be listed and categorized, but we will not be able to know where I need to prioritize and where I need to concentrate more to eliminate my problems. So where this Pareto chart will be clearly explaining what are all the areas I need to concentrate, and if I concentrate in the when I give the priority to that and I concentrate more onto it, my 80 percentage of my problem, the problem which is causing to the errors, can be eliminated. So next is the line chart. Line chart is mainly we use for knowing the trend. So in order to know the compliance of the hand hygiene trend in our organization, the time series for 1 year is taken. So this that displayed hand hygiene data. There is what is the changes? Any improvement is there? What is the performance of the hand hygiene? The hand hygiene I will be able to know. So where the improvement has happened, where during the which month there is a rise, where on which month there is a dip in the entire year. I will be able to know through the through this line chart. So that is what this hand hygiene compliance line chart is also explaining. So I will be able to do the same thing for the patient vital signs chart also, and for the waiting time in the OPD also, I will be able to display it into the line chart. So next is the run chart. Run chart is mainly to know what is the patterns and what are all the shifts in a process. So we need minimum 12 months of data for displaying the run chart. So here I have taken the re-exploration or re-exploration happened in a 24 months of period of time. So this has been displayed over here. So in this chart, there is no trend in the chart which is displayed, and there is a shift below the median. There is a shift below the median which we are able to see, and there are too many runs is also there. So there are too many runs which is running through the medians. I'm able to see. So there is one astronomical point is also there in the graph. So as there is the evidence of non-random pattern is going on, the change has occurred, and change which is not consistent. That is what I'm able to see from this run chart. So the same way, I will be able to display the length of stay of the patient over a period of time, and incidence of CLABSI and other infection rates. I will be able to see through the run charts. So the next chart is the control chart. The control chart is mainly we will be able to know what is the common cause of the problem and what is the special cause of the problem. So here I have taken the stockouts in the pharmacy. So we always have in the pharmacy we do have our reorder levels. So the upper control level and the lower control level I have calculated using this formula. The median is about 15. So that according to that stockout data, the data is also the chart is also displayed. So the stockouts in the pharmacy is monitored and displayed in the control chart. The data points which is falling within the upper control limit and the lower control limit, I will be able to know that there is the process is stable. So there is only one point in during the September there which is falling above the upper control limit. So that is the special cause which is contributing to the contributing for the stock out. So we will be able to know that that month we have to investigate what really happened. So otherwise the when it is falling between the upper limit and the lower limit, it shows the process is stable and the stockouts are within the expected range and limited range. So other examples is the number of falls in the hospital, number of medication equipment breakdowns, the hospital infection rate, and internal quality control for the laboratory. So these are all the data which we will be able to display into the control chart. And this is the radar chart, and this is very interesting one because all these days whenever we are doing the gap analysis, I have always presented the gap analysis only in the form of 2 to 3 pages of either into Excel or into the by Word document. But here we will be able to show it in a simple diagram, that is through the radar chart. So through the radar chart, I will be able to know where I will be able to, where I have to concentrate, where I have the greater amount of compliance is also there. So every month there is a IPST compliance audit is happening in an organization, and for a particular period of, for a particular month, this is the compliance rate. So the same is showed in the radar chart, where the IPSG 1 has the very lower compliance and IPSG 4 has the very good compliance. So this is the very good pictorial diagram. I will be able to know immediately where I am lying. So it shows the outliers and what is the compliance of compliance throughout the month for the standards. The same way we can display the same thing through for our facility safety audit compliance, for our HOSMET audit compliance, for our QI standards, for JCI and NABH standards also, we will be able to show through the radar chart. Next is a scatter diagram. The scatter chart is mainly for the relationship. So there are two variables, how it is affecting one another, how it is getting related. So here it is the radar chart, scatter chart is displayed for the time the doctor is spending with the patient versus the satisfaction of that patient. So here, but through this the data, the scatter chart, it has been coming to know that when a doctor is spending around 15 to 20 minutes of their time with a patient, their satisfaction rate is high. It is falling between the 4 to 4.1 to 5. When the patients, whoever is getting time only by 4 to 10 minutes with their doctor, their satisfaction rate is only one falling between 1 to 3.5. So through this scatter diagram, I am able to understand that if approximately the 15 minutes, so if a doctor is spending 15 minutes with a patient, their satisfactory level is good towards the services provided by the hospital. So the same way for the other examples, the average time for the OPD and the discharge process satisfaction rate. These are all the data which we will be able to put it into the scatter diagram, and we will be able to understand what is the relationship between how it is affecting one variable and the other variable. And the next is the Gantt chart. Gantt chart is the process, and we will be able to know the relationship where one how the process is getting started for one project, how it is getting ended. So this organization is planning for the NABH ER certification, and they are planning it for within the 6 months of period of time they have to finish the entire process. But the actual process took around 10 months of time. So that 10 months of period is what really happened. That is what it has been displayed into the Gantt chart. So these are all the different types of charts we are using into our day-to-day life for our quality data collection. So any questions?
Yes, ma'am. Good evening.
Good evening, sir.
Yeah, thanks a lot for your presentations. Excellent.
Thank you,
Lot
sir.
of new informations. But
Thank you, sir.
I have some questions regarding your control chart.
Yes, sir.
And so why still you are using only Excel? So what is my recommendation? Better to use some statistical software like Minitab or SPSS. We cannot use, especially for Pareto chart, even for control chart. We cannot use Excel because Excel is there is no program in Excel. Correct? Excel we can use only for basic things. So this is my recommendation to all, not only for you. So this is my recommendation to all. Please try to use statistical software, uh, especially for advanced statistical analysis.
yeah, sure, sir.
And
Sure.
Surya ma'am, what about your
Yes.
what is the formula for UCL? UCL is equal to what is the formula? Mean plus 3 square root of mean. From where you got this formula? UCL is equal to, actually the formula is mean plus 3 standard deviation, correct? Actually UCL is equal to, what is the formula, ma'am? UCL is equal to
Mean
mean plus 3 standard deviation,
mean
not square
plus
root of
3
mean.
standard deviation.
Then why you wrote square
Okay.
root of mean? Square root of mean is not standard deviation, correct? So we should use only three multiplication of standard deviation, 3 standard deviation, not just a square root
Okay.
of mean, correct?
Okay, sir. I'll
From where
correct.
you got this? From where is there any reference for this?
I'll tell you, sir.
Okay.
I have noted it. I'll
Yeah,
tell you.
please check that reference.
Okay. Sure, sir.
Okay. And so these are all basic graph, correct?
Yes, sir.
So what are the other graph we can use in healthcare quality practice? Do you know any other graph? Bar chart, pie chart, Pareto chart, histogram, control chart is okay. But what is your recommendation regarding the chart for KPI? So generally because key performance indicator play a very important role in quality practice. So what is your recommendation for KPI? Which graph we can use always for key performance indicator? And what is your current practice and is there any graph?
Currently, for all the quality indicators, currently I'm using only the bar chart as we already discussed, sir.
Yeah,
So
yeah.
now, so now I have started to.
Is it possible to share your experience to others? Why you are using bar chart and what is your current practice? What are things you learned from this? Is it possible to share your experience to others? Because now we
Yes,
need to
sir.
create
So
awareness. The purpose of this webinar to create awareness about the importance of data analytics, the importance of data-driven cultures to others. Correct?
yes, sir.
So
So,
try. Yeah, please, ma'am. Please, yeah.
so yes, sir. All these days we were using, I am using only the bar chart because into the NEBH standards, it is clearly told in the fourth edition that bar chart is used to interpret all the data for the key performance indicators, the quality indicators. So
Oh,
after attending to this
so
class,
there is
yes, it is
there is
mentioned.
standard from any age.
Yeah, it is there in the NABH. It is
Oh.
in the fourth edition book. It is there. So all these years, that is how it has been presented. Also, for the JCI, audit, also we have presented our quality indicators or key performance indicators in the bar chart only. So later on, after attending to this class, I am able to understand there are the other charts which I will be able to use. So few of those things only I have already used into my current process. That is what I have used for this presentation also. So the do not disturb time is the real time which we have collected from our organization, and for the IPSD compliance is also the real time data we have collected. Every month we are doing or doing audits. The audits is always presented only in the reports. So now I am able to present it into the diagram. And
Okay.
Pareto chart is my currently my presently my favorite is a Pareto chart, because
Okay.
whenever in all the root cause analysis or all the quality improvement projects, we are always using only the fishbone diagram as the cause and effect diagram, but it is
Exactly.
not clearly telling where I have to concentrate more. Though it is little bit for quality professionals, whoever has studied this course, they will be able to understand all these charts. But whenever we are presenting to the common group of people from our own hospitals, from whoever is from the operations or from the nursing area, when we are going to present it to the common audience, whether they will be able to understand it or not, we do not know. I have to yet practice into it. But the Pareto chart is very clearly explaining where I need to concentrate more. So
Okay.
when I am comparing to the fishbone diagram, so that is where I have learned it, and I started to use it in my projects also. So every month we are every 6 months once we need to do a quality improvement project, and I have already implemented that Pareto chart also into my quality improvement project. Yeah,
Excellent.
that is it, sir.
Excellent, ma'am.
Yes, thank
And
you.
so we can use even some statistical software for the construction of each and every graph. So there is no problem for the construction of graph.
Sure.
But as a healthcare quality professional, what is our main responsibility regarding the graphical representation? What is our main role and responsibility? We can collect data, even we can use some software for the construction of graph. So there is no major problem in the construction. But what is our main responsibility regarding the construction of graph? Even if you're going to present this graph in front of your top management or even in front of accreditation people, what is our main responsibility?
No, sir.
Suppose even if you're going to construct Pareto chart for operating room cancellation, or even for reason for emergency overstay, we can collect data and we can present with the help of Pareto chart. But after construction, what is our main role and responsibility, ma'am?
So the process improvement is lies after, while after knowing the problems, we have to rectify those problems. We have to find out our own solutions.
But
It is always a teamwork.
yeah, but as a healthcare quality professional, we need to know how to interpret each and every graph, correct?
Yes.
How to interpret. Even we can use Pareto chart, but what kind of information we can able to get from Pareto chart?
Yes.
So what is the conclusion from each and every graph? This is also one of the important role and responsibility of quality people. We need to know how to interpret the basic graph as well as advanced graph. Otherwise, how can we recommend action? How can we convey our message to others? And what is your recommendation? We can use line chart, run chart, and control chart for time series data, because as per your first and second slide, these are all we can use for time series data: line chart, run chart, and control chart. So which one is more appropriate for time series data, ma'am?
For me, according to me, it is run chart, sir. So it has the median. I will be able to know what is the trend and pattern into it. Instead of line, I will be using only run chart.
So you will not recommend control chart?
Control chart, when I do have the upper control limit and the lower control limit, it is not that every data I will be having the upper control limit and the lower control limit.
No.
So when I'm,
for example, I have data about patient fall over a period of 12 months.
Yes.
Falls rate over a period of 12 months from January to December. I want to visualize this data by a graph. Which graph we can use?
I will be using the control chart.
Why? Why not run chart?
So, run chart also I can use, sir. But control chart, I will be able to know within the limits of, within my limits where I am standing. So whether
we can use
the deviations.
we can use either run chart or control chart.
Yes.
But which one is more appropriate? Is it possible to choose anyone as per our convenient, like sometime run chart, sometime control chart?
I think it is control chart, sir.
Control chart. Okay. Okay. So thank you, ma'am. Thanks a lot.
Thank you, sir.
Your excellent presentations. Any questions from others, please?
So good evening.
Good evening, ma'am. Please.
Yeah. Thank you, Surya. It was a good presentation. On behalf of the group, I will congratulate you for this. I've only one or two comments, sir. As per the fifth edition of NABH, the current edition of NABH, which is the fifth edition. Here, na, sir, they have written that the KP, the quality indicators data, QI data, we should use statistical tools to analyze. Okay, this is only the one line, the one sentence. Now, which tool, what tool, and when they come for audit, sir, everybody presents them in the form of red, green, yellow bar charts only. So, and we don't get those comments from, from them. I mean, it's okay with them. They accept that, and that's how a QI presentation in the audit would go. So they have added one line of use of statistical tools. But the thing is, limited knowledge with everyone, and even if one would present how to interpret is the most important thing, because even if we make a control chart or how Surya is saying, suppose we have 12 months data of the total number of falls. So in say 1 month, we have 4 falls, and all the other 3-4 months, it was only one fall, one fall, one fall. So that if I plot, that, in my, unknowledgeable way, then it will be, it will look like 1 September, it was 4 fall. But actually, if we are not calculating, we are not seeing whether our data is normal, then we'll calculate the p value, then the mean, then the standard deviation, then upper control limit, then lower control. And one more thing I would say, sir, from my experience, to
Yes, ma'am.
calculate the standard deviation, to calculate the upper control limit, lower, is not easy and possible with our current Excel.
Hmm.
We
Exactly.
can't do that. We can't
That's
do
why
that.
we should use some advanced statistical software like Minitab
So
or
the
SPSS.
so what is it? The other option is to show it in the form of bar chart, just the count. It is just the count. One fall, two fall, three fall, or maybe the incidence can be shown as a downward trend in the
Yes.
form of line chart. That's it. So I think we all not every not we don't have that access to that software and all in our setups today.
Okay.
So it's extremely difficult for us to calculate with Excel. And why would anybody will go into it, sir, when we can really show the count of all across the year in the form of a bar chart? So that is fine, I think, and that's how any page also doesn't.
Actually, Dr. Yashma, ma'am, the purpose of
Hmm.
quality not to satisfy NABH
Yes,
people.
NABH, yeah.
This is not to
True,
satisfy
true,
your NABH
true,
people. This is to
true,
improve your organization, to improve your patient satisfaction. So, if you want to improve patient satisfaction or if you want to improve our system, we should use appropriate tool. We cannot choose tool as
yes,
per our convenience, ma'am. I don't know
yes.
many, so I'm going to use only Excel. I don't know anything
Huh,
about control, so I'm going to use only bar chart. How can we do like
huh,
this? Correct?
yeah. And there's no knowledge also, sir. Lot of requirement is there for awareness. We
Yes,
don't know, most
lack
of
of
us don't know.
awareness. Many
Yeah,
people not aware about this kind of tools.
yeah. Like C chart, which you are saying now, which you want us to answer. T chart, we won't know, sir, if we have not read about it or not done it. We won't know. The common other members of this group they will not be able to how to calculate T chart, then how to use Minitab. So this is the biggest limitation we have, sir, today. And we
Yes,
only have to keep on having these kind of webinars, which to create awareness.
exactly, ma'am. Sure. Yes.
So good attempt from Rishi also. Congratulating you for that.
Thank you, ma'am, and
Let's
thanks to.
continue this kind of webinars. So it's a brush up for all our.
Sure, ma'am. Sure. Yeah.
Yeah, we should get back again on
Yeah,
that those webinars very regularly.
we'll discuss some real scenario how to use
Yeah.
statistics in our practice. Yes,
Thank you, sir.
thank you. Any other questions from others, please? Any questions from others, please?
Hello, hello. Yes, sir.
Yeah,
I have one question.
please, ma'am.
So I have numbers, all information I have. I have all the numbers, and so why do we need to prepare the charts? Because I have a software. I have always this question. This problem is generating for me. I have all the numbers from the software. So just to show like CPHQ, like this is the just to show them, because I get all the information from the software. So can you give me an answer for that one?
Yes, yes, ma'am. Actually, data is not information, correct?
Yeah.
Data is unstructured format.
Yeah.
If you want to convert into information, we should present our data. We need to classify our data.
Yeah.
So which tool we can use for data presentation? Graphical representation. This is to convert your data into information.
Yeah.
This is to see what is going on in your process, correct?
Yeah.
This is to diagnose your data. We cannot use only percentage, basic mean. We should use some advanced statistical tool, ma'am, to know the exact root cause, correct?
Yeah.
So if you want to use advanced statistical tool without data diagnosis, how can we do advanced analysis? How can we use only fishbone in quality practice, ma'am? Fishbone was developed in 1921. Now we are in 2022.
Yeah.
How can we use only fishbone in quality practice? Why there is no update? How can we use only data to show in front of others, ma'am? Percentage, number of falls, number of ulcer, number of infection. Is it enough? Is it more effective presentation?
No.
So what is the recommendation from literature? We need to know what is going on in the market, correct?
Yeah.
We need to know what is the recommendation from international organizations.
Yes.
We cannot show one number to
Yeah.
improve, correct?
Yeah, because right now I'm getting all the numbers, and I'm just for statistics, and my for when the audit is coming, and then I can show the numbers. But this is a good way for me to present now the graphical information along with that one.
Even if you want to improve communication, teamwork, if you want to
Yeah.
share your data to others, better to present by graph.
Yeah. Thank you very much for this wonderful information.
Welcome, ma'am.
Thanks, Surya, and thank you, sir.
What do you think, Surya, ma'am? What is your answer for this question? Please, Surya, ma'am, please.
Yes, sir.
So what is, because
Yes, sir. Tell me, sir.
so what is your answer regarding this question? Because she's asking why we need to present, why we need to use graph. Already there is EMR. We can collect data.
Sir,
Even from here,
presenting
EMR is,
the
yes, ma'am.
So presenting the data as a diagram or a chart, it is easily we will be able to interpret. So that is the main reason we are using. But as she said, we many people does not have the knowledge about it. And also when we are telling that some of the statistical tool we have to use like mini tab, so how much it will be afforded, who will be afforded, these are all the problems which is there. And this course is taken on my own interest. There is no, as we already discussed, this is what the qualification is required for the quality manager, and they will be doing these are all the things, and these are all the interpretations they will be doing. So there is no any rule currently here also. So as she said before, in the fifth edition, they have told that the statistical tool, appropriate statistical tool has to be used. But in the fourth edition of NEBH, it is in the annexure book of the quality indicators. It is told that the presentation of the quality indicators has to be in the bar chart.
But Surya ma'am,
yes,
why
sir.
we need to focus on NEBH standard?
Sir, I am not telling that we have to focus on the NEBH standards. Before the NEBH standards, there was no focus at all on the quality. People does not even know there was no people does not have the knowledge about what are all the main things we have to maintain in our organization. Before though we were having the IPHS standards in Indian Public Health System standards also were there, people were unaware. So only after the NABH standards has come, we do have at least standards which is overseeing the quality of the organizations. The data is being collected, which is happening only the past over past only 10 years. So using all the statistical tool, again getting one form of quality into the healthcare. So we are still looking forward to the future. That is what I'm seeing.
Exactly. Yes. What about your organization? Whether you got NABH certificate and JCA certificate?
Yes, we are NABH and JCA certified.
Whether you publish any article, right? The impact of JCS accreditations or NABH accreditation.
No, I am working on it, sir. Actually, I'm working on it. I'm yet to.
Is there any significant change after getting the certificate in your organization?
The significant changes, we know that these are all the important things which we need to concentrate, and there is a knowledge about the patient safety. And still, I would like to tell that even the standards are not concentrating on employee welfare or the other employee safety aspects. So the employee safety aspects is only during the radiology, hospital infection control. In these areas, only the concentration is there. But what about the employees who is working in the medical gas system, or who is in the near the generator box? What is the what are the checkpoints I do have for the ambulance driver? So these kind of checkpoints, it is not actually we are not concentrating, or the auditors whoever is coming to the organization also they are not doing. So there is a significant change after getting into this all certifications. But all this 15 to 16 years of experience into the entirely quality, and I have worked into almost all the hospitals in Chennai. So what I see is it is all everywhere they work same, whether we do have the NABH or JC accreditation. The it is not towards the quality. It is not towards the quality of patient care or the healthcare services. It is the everywhere they are functioning in the same mode, and it is only on the accreditation on the certificate point of view. So few of the organizations like global, like MGM, they are concentrating really onto it. They are not concentrating on the paper of the certificate. They wanted to really implement the NABH or the JCS standards into their hospital. So that kind of a mentality is yet to come for the that mentality is yet to come, actually.
Sir, good evening. Sir,
sir.
actually, you have told that the fishbone diagram was invented. It was a very old thing for root cause analysis. So, could you please guide us with some new idea by which we can do the root cause analysis nowadays?
Sure, sir. Because we are going to conduct many webinars about RCA, so we'll discuss about those tools. Okay, don't worry.
Thank you, Ms. Surya, for answering those questions and for your great presentation. It was really a pleasure to have you with us. Thank you all for attending this webinar. We hope you have learned and enjoyed this presentation. Thank you.